All right, so thank you for the global tallies. Here in Korea, health authorities believe our Omicron peak may become a prolonged affair. For details, I turn now to SHIN Ye-EUN. Ye-EUN, good to see you again.
Great to be here, Sunny.
Right, so the growing presence of Stealth Omicron is looking to prolong our fight against this latest wave. Ye-EUN, tell us more.
That's right, Sunny. While many health experts have been forecasting that the country will pass its Omicron peak by next week, officials say the growing number of Stealth Omicron cases could prolong this wave, and this is mainly because other countries previously hit by Omicron, like the US or UK, have seen a fresh rebound in cases due to this subvariant. Now take a listen to what the KDCA chief had to say during Monday's briefing.
Stealth Omicron is known to be 30% more contagious than the original Omicron strain. It's also responsible for around 60% or even more COVID cases worldwide. Though this subvariant won't lead to a new wave of the pandemic, we do think it could prolong the current one we're in. So we will keep a close eye on its spread.
Also known as BA2, Stealth Omicron is reportedly much more contagious than the original strain and already responsible for more than 40% of all locally transmitted cases. It also took up nearly 57% of all imported cases in the country as well. But there's no scientific evidence proving that the subvariant is more fatal than Omicron. And the most common symptoms of Stealth Omicron is dizziness and fatigue, which usually appear 2 to 3 days after being infected. As suggested by its name, Stealth Omicron has been difficult to detect with current PCR test kits that are used widely across the globe. But Korea has been using a homegrown, updated PCR test kit that is set to be effective in detecting all variants from Alpha to Delta and even all strains of Omicron.
Right, yeah, now that is reassuring to know. But on a worrying note, the number of severe COVID-19 infections as well as that of fatalities, like Soa mentioned earlier, remain quite high in the country. How are officials responding?
Well, for the third straight week, authorities have maintained their COVID-19 threat level at its highest mark, and this comes as roughly 7 out of 10 ICU beds are occupied nationwide amid a spike in the number of critically ill patients and deaths. In a week, we've seen the number of critically ill patients increase roughly 12%, and the number of weekly deaths jump by a whopping 45%. Korea is also running low on stocks of Paxlovid, the only antiviral pill that has received the green light from the country's drug regulator. That's why the government is planning to take delivery of some 100,000 courses of Lagevrio this week. Now, this is another oral COVID-19 pill, also known as molnupiravir, manufactured by Merck. Though the government has a pre-purchase agreement for some 242,000 courses of Lagevrio, it hasn't yet been approved by the drug ministry, citing efficacy reasons. While Paxlovid was found to lower the rates of death and hospitalization by 90%, Lagevrio only did so by 30%. But authorities have determined an alternative drug is needed to treat high-risk patients who cannot be prescribed with Paxlovid because of drug-to-drug interactions with their other medications. As of now, only seniors age 60 and up, the immunocompromised, and those 40 and over with underlying conditions like diabetes or cardiovascular disease are eligible for the drugs. The country's drug regulator will make their final decision as to whether they will grant emergency use authorization for Lagevrio by Thursday at the latest.
Right, and that would be Thursday this week then?
Yes.
All right, Ye-EUN, thank you for now.